Welcome back. This week we are learning more about head and neck cancers, which can include cancers of the throat, thyroid, trachea, and voice box.
Dr. Neal Dunlap from UofL Health is here with us today. Thank you very much for coming in, doctor.
Hey, thanks for having me. Appreciate it.
So let's start here with who is most at risk when we're talking about this kind of cancer.
So yeah, we used to always think this was people that were smokers, drinkers, and that kind of thing. But now we're starting to see more and more cancers arise from a virus called HPV. So a lot of people have heard of HPV virus connected to cervical cancer in women. But we also know that men and women are at risk of developing cancers in the throat, especially from this virus.
What kinds of symptoms would a person start noticing that might be in trouble?
Yeah, the unfortunate thing is that a lot of these symptoms mimic like a cold. So sore throat, kind of swollen glands in the neck. So a lot of things get kind of confused with being a viral illness. They go to their primary care doctor, get on antibiotics, and then things just never really get better. And that's when you need to seek out additional help for evaluation.
Would they be having like prolonged colds, or they keep coming back?
Prolonged sore throat, a lump in the neck that doesn't really resolve with antibiotics, coughing up blood, like more serious symptoms like that.
Oh, wow. Okay, so if they are seeing these symptoms, they end up in your office. What are some of the treatment options should they get a cancer diagnosis?
Yeah, so the thing about treating head and neck cancers is that it really requires a combined approach with surgeons, radiation, and chemotherapy or medical oncology services. So the more you integrate those services into a patient's care, the better their outcome is. So advanced robotic surgery, advanced radiation techniques, and targeted therapies for special genes and proteins on cancer cells now.
When you're talking about the targeted therapies, what kind of recovery are we talking about with that kind of process? Or how long is someone?
Yeah, so the unfortunate thing with this type of cancer, it's probably one of the hardest cancer treatments to go through, just because we swallow so much. We rely on our mouth to be able to eat food and supply nutrition, and so it's very difficult. So what we're really focused on now is how do we minimize the side effects but still provide a cure. And so with these viral-related cancers now, we're seeing people cured about 90% of the time. So what we want to do is, I tell people, we want to put this cancer diagnosis behind you so you can go on and live a healthy, normal life. And so that's really where our focus is in research, by improving our techniques for treating cancers.
I know UofL Health has some really innovative approaches to this. Tell us a little bit about that.
Yeah, so we have advanced robotic surgery where the surgeons can use these specialized instruments to be able to access tumors that otherwise we would require a horrific surgery to get to. We have targeted radiation treatments where we can map the radiation specifically to the cancer drainage patterns so we can minimize side effects to the normal tissues in our body. And then a lot of the drug-based therapy is really designed away from just giving blanket chemotherapy that can destroy normal cells, but we really want to target the little proteins and special signals on a tumor cell so that we can be more exacting in our treatments.
Awesome. Well, doctor, thank you so much for coming in and telling us about it. And certainly folks can seek UofL Health if they have an issue or think that, they may be having some of these signs and symptoms.
Yeah, absolutely.
All right. Thank you very much.
Appreciate it.
Still to come.